Hello, my name is Lisa, if you don't already know, and today I wanted to share with you the story of my fourth birth to Miss Maya. She was born 6 weeks ago now. Before I get into her birth, I'm just going to go into a little bit of a background of my previous births, and then you can kind of know how my past experiences kind of influenced my choices in this birth as well. First of all, where I live in Saskatoon in Canada, most people do hospital births. I have never heard of anyone having a home birth personally. I think people do have home births and you can get midwives here, but in Saskatoon there's limited spots for midwives, so you have to apply and they have to accept you as a patient. There is not very many spots available. So I have always had hospital deliveries. I have always gone to OBs throughout my pregnancy, and I always feel comfortable myself just taking their advice and following their lead, because I want to have the care provider feel confident in the plan and not push for other things because I've watched a YouTube video on it. Because I feel like this is what they do every day for their job, and they probably know a lot more than I do. Also, I want whoever's delivering my baby to feel comfortable in what they're doing, so nobody's anxious or panicking or anything, so the vibe is calm. So that's my kind of mindset going into birth. With my first 3 births, first I go to my family doctor for the first 20 weeks, and then he refers me to my OB for the last 20 weeks. This pregnancy, I didn't want to do that. Number one, because I wanted to try to have a lady OB, and my previous OBs had been male. And secondly, I feel like my family doctor in the past has felt like two is enough children. I had my 3rd baby. He thought that was crazy already. So I don't know. I just didn't feel like getting judged. Though now that I'm taking her to the family doctor for her pediatrician appointments, and he's not at all making me feel bad. He is very kind. I don't know, for some reason I felt like he would judge me. Anyways, that's besides the point. I did really enjoy going to this lady OB. I felt like she was very good. I'll get into a few other points later on as to why I appreciated her and the difference. So my first baby was 10 days overdue, so the doctor recommended I be induced, which I did, and that was a long process because I had to have Cervidil, which is a little tampon they put up in you to start contractions. I went in there at 9 a.m. Then it took until 3 p.m. till they even seen me, and then they put the Cervidil in, and then they send you home, and then it fell out at some point in the night, so then we had to go back, and then we had to wait, and because the labor wasn't progressing, there was so many people coming in. I kept getting bumped and bumped and bumped, and I finally got to go into a delivery room at 8 in the morning or something the next day. Then we got put on the Pitocin. Eventually I got an epidural, and then waited and waited, and then we had her at 11 at night. So that was a whole 2 days in the hospital just waiting for things to get going and waiting for there to be space available for us, and it was a long process. And then she had jaundice, so then we had to wait an extra day on the other side. So we were in the hospital for 5 days. So that was so long. You get so tired of being at the hospital. Inducing is not that fun. My second baby was also 10 days overdue. So with him, when they called me to go in and get induced, I was already slightly dilated, enough that I could skip the Cervidil part, and I could go directly to the Pitocin on the IV drip, which, thank goodness, that cut a lot of time out. And that one, so I went in there, at 10:30, I think, something like that in the morning, and then got put on Pitocin sometime in the afternoon, and I had him at like 3 in the morning. Okay, 2 things with that birth. That birth was my most traumatizing birth because for whatever reason, I kept asking for the epidural and they weren't giving it to me. And by the time I got it, I was like at 8 centimeters and I was like dying. And I was not mentally prepared for like pain tolerance because my pain management plan was to get the epidural. So I didn't mentally prepare myself or have any kind of like techniques that I had learned beforehand to do pain management. So that was hard. And then after birth, my iron levels and hemoglobin was so low that I almost passed out. So I had to like pass him off to my husband, the baby off to my husband right after birth because I couldn't hold him because I felt like I was going to pass out. But they got like an IV in me and I started feeling better after that. But then, yeah, when they checked me, I was so weak with that second birth. Anyways, going into my third birth, I made sure to get my iron levels checked. So I didn't do that. So that didn't happen again. For my third birth, I had red raspberry leaf tea was supposed to help induce labor. Or I had heard on YouTube or something. So I started drinking red raspberry leaf tea once a day for my whole third trimester. And I ended up giving birth 2 days early by myself. I went into labor by myself 2 days early. I went into labor around like 9 in the morning. And I got to labor at home most of the day. And then I went into the hospital like probably, I don't know, late into the evening, like 8 or something, I think. So I labored at home for 12 hours. I got to the hospital. It was like 5 centimeters. They let me, they checked me in. They gave me the epidural right away. So the pain management was good. Because I was just getting to the point where like it was getting too intense to handle just like breathing through it. And then I delivered that, like, then I got to rest a little bit. That's the great thing about the epidural. And then I delivered him at like 1 in the morning, just after 1 in the morning. So that was like the most like magical unicorn birth story I could have asked for. And it was so great compared to the induction 2 previous births I had before. So going into this fourth birth, I was, number one, I wanted to be prepared, like pain management wise, if I didn't get the epidural in time, which I felt like with the third birth and watching YouTube and stuff, I kind of felt more on top of that. And I started watching, like, there's this labor and delivery nurse on YouTube that I like to watch that goes through all these different things and different pain management and, talks about all this stuff. So I like to watch her to prepare. And I was doing that like, a month or 2 ahead of birth. I was getting ready for all the things, that could happen during labor. And mentally prepared for that. Also, with my new OB, she was checking my iron levels routinely, which I really appreciated. So my iron levels did happen to get low, so then she put me on iron supplements, which was great. So I had the energy. I wasn't like, dying from anemia before birth this time. And the other different thing that they did with this OB was she did third trimester ultrasounds. So I went in at 37 weeks for a third trimester ultrasound. They kind of knew she was measuring large anyways, but was, confirmed with the ultrasound she was large for her gestational age. But the other thing that was confirmed in the ultrasound at 37 weeks was she was breech. My doctor confirmed, yes, she's breech. And I was not comfortable delivering a breech baby. And I don't know, I didn't even ask her if she would do that or not. I wasn't comfortable trying because I felt like that would be like way too much anxiety in that. No. So yeah, the option was C-section. So she said she'll schedule me for an ECV before we tried to do the C-section to see if they could just flip her externally. I went in at 38 weeks for an ECV, and when I went in there to the hospital for the appointment, she had already flipped by herself. So she had flipped, within the 5 days between the ultrasound and the ECV appointment. So thank goodness for that. But then at my next doctor's appointment, according to the ultrasound, when I went to the ECV, she was like 9 pounds, 10 ounces. And the other concern was her head wasn't engaged in the pelvis yet. So she could flip again to breech. And my doctor said she's getting too big and she wanted to prevent like shoulder dysplasia, like her shoulder getting stuck during birth if she gets too big. So she wanted to induce me at 39 weeks. And like I said previously, even though I did not want to be induced, I do feel like I want to go with what the doctor is recommending. And I do feel like my doctors, are trying to make the right decision so everybody ends up alive and safe and healthy. And they're not trying to push their own agenda or make money or whatever. So I, obviously went along with the plan, and getting induced at 39 weeks, there's more incentive there because you get to skip like possibly 3 weeks of pregnancy. And when your hip, like my hip was hurting by that time, you're so uncomfortable anyways. 39-week induction sounded okay. It was induction, like making the birth be a little longer or staying in the hospital a little longer sounded like a good trade-off for, possibly 3 more weeks of pregnancy. So that was good. Going into that was a lot better than induction at, 42 weeks basically. So the doctor said she would get the hospital to call me at 39 weeks. It was supposed to be Friday. So I was prepared for that. I got all prepared for that. I woke up, Friday morning and had the house all clean. And then I waited all day. And they called me at like 5 p.m. And then they said they wouldn't have time for me that day. So that was kind of like a bummer. But they said they would call me on the next day, and I might be able to come in and get induced that day, but don't hold my breath because I could get bumped too. Because it wasn't an emergency, I didn't have priority. Saturday, I didn't want to spend the whole day waiting around for a phone call that wasn't going to come again. So I got the kids ready after breakfast to go to the mall and walk around and spend some time because it's December here and it's cold. And you can't just go walk around outside for a long amount of time. We got all ready and we're driving to the mall, and the doctor and the hospital called me at around 10 this time, 10 in the morning, and they said they had room for me. So I got to the hospital around 10:30 on Saturday. And then we had to do like all this paperwork and stuff, and they checked my cervix and I was at 2 centimeters. So they said like they could start doing like all the Cervidil or like other ways. There's several different ways to get your cervix more dilated. Or we could just start on the Pitocin IV drip. And it might take longer, but it would be just like simpler. Then we'd just be like set, and you could get the epidural anytime you wanted and all that stuff. So both myself and the doctor thought it would just be easier if we just started on the drip and went from there. So I got on to they hooked me up to the Pitocin around noon on Saturday. And then, like, nothing happened for so long. Like, I never felt like anything. Like, the first 2 times I got induced, like, I could feel contractions, like, quite quickly after they started in the induction process. But this time, like, I never felt any contractions. I just felt, like, mild cramping, like less severe than a period cramp for a long time, for, like, hours. And, like, did you put that Pitocin on already? And they're like, yeah. yeah, we put that on. Like, okay, well, I don't feel like nothing's working. Also, like, they put the contraction monitor and the heart rate monitor on your stomach to monitor things. But, like, those monitors weren't picking up very well, and she was moving around, and I think that they were just, the machine wasn't working properly because they kept having issues with that, and it kept, like, not picking up any contractions, or the heart rate kept coming off the monitor. So that was a little bit irritating, and the nurses kept trying to fiddle with that, and I kept feeling bad if it would, like, if I would move and then it would make it screw up again. We did that for like a good amount of time, past like 7:30, because at 7:30 the like shift change happens. So then I got a different nurse at 7:30, and this nurse was like she was young. I think she had been nursing for like just a couple of years, but she was so good. I was so impressed with her for like how young she was and how experienced she would have been, you know. She did a great job. She was like, I don't know if that, like, sometimes the Pitocin bag isn't mixed properly or something. Maybe there is not enough Pitocin in there, so she got a new bag of Pitocin and put it on. And then she was like, you know what, this monitor's, it's not working. And she ended up getting like a monitor that you just put up directly into the uterus and can hook up to the baby's head, and that can trace the heart beat that way. Because then it was easier to keep the monitor on the heart rate, so I could move a little bit more, and then I could go to the bathroom easier too, because it was just like taped to my leg and like hooked up to my IV pole, so she didn't have to redo it every time around with those bands. And then eventually I ended up getting a contraction monitor put up into the uterus as well. And then that was picking up my contractions better. So she was saying, well, yeah, you are contracting now. So the monitors must have been kind of screwed up there. But anyways, eventually that nurse said, like, you might want to just get the epidural now, because the anesthesiologist is going into C-section and won't be available for a while. And then the doctor was talking about breaking my water, and I wanted to get the epidural before my water was broken, because I have heard it can get more intense. Like, the pain gets more intense if your waters are broken. So I did end up getting the epidural before I felt any kind of like regular contractions or anything, which ended up being the most nerve-wracking epidural I've had, because I didn't have the pain there to be like, I don't care what I'm risking, I need this pain to go away. So I was quite nervous, and I'm always just nervous because they want you to stay very still when they place the needle in your back. Otherwise, you know, you could get like paralyzed or something. So I'm nervous I'm going to like freak out and move at the wrong time and then paralyze myself. Which, like, with my first epidural, I wasn't expecting this, but like there was cold that shot up my back, so I did kind of jump when I got my first epidural with my first baby. So yes, I am always nervous, but because I'm prepared for that feeling now, I usually do really well, and I stay still and nothing happens. And I have always had good experiences with epidurals. Nothing has gone wrong. They have worked really well with the first and this one now. I was able to feel pressure. I did not feel any pain. I did feel pressure with the first and the last. With the second and the third, I didn't even feel the pressure. Because I think, I didn't feel anything, so they had to tell me when to push. But with this fourth one, with the epidural this time, I did not have to get a catheter. I don't know why. Like, in some of my past experiences, I have had to get a catheter and sometimes not. I don't know what the reasoning behind that is, but this time I didn't have to, which was great. So I could still like get up and walk and go to the bathroom by myself. I just didn't feel any pain. So that was great. There was still like a waiting game. I think around that time too, it was like getting around midnight. So it had been 12 hours since I've been on Pitocin. And at that point, I think like they have to get approval to keep continuing giving you larger doses and keeping you on for that prolonged period of time, because risk factor goes up. Hemorrhaging, I think, was the main concern. But the doctor gave consent and we just kept going. And though my like cervix was not dilating very fast, I think at 3 a.m. I texted my family to say like, sorry, I'm not giving any updates right now, but like nothing's happening, so there's nothing really to update on. I'm still like at a 4 or something like that. That was at 3. And then shortly after that, I started feeling things happening and I could start feeling pressure, and things happened quite quickly after that. Yeah, so then the nurse checked me and she said, oh yes, like you're fully dilated and you can be, like, we'll call the doctor to start pushing. So the doctor took a long time to come because he was busy with something else, I guess. The nurse had said, it's okay if we have to wait for a while because your body, is involved. Your body is still like pushing and she's coming down more. And then like the further down she comes by herself, the less you have to push afterwards. And that I really appreciated. That seems to be how it works in the hospital that I give birth in, because I have never had to push for very long. Like I think half an hour or less with all my births. So, because it's my 4th baby too, I knew that the longer I waited, the less I would have to push. So I was not super worried that the doctor wasn't coming right away, but it was getting intense. There gets a point when the pressure just gets too intense. It's hard to control your body and not go crazy a little bit. Eventually the nurse did call a backup doctor because the regular on-call doctor wasn't coming, and I was involuntarily pushing and she was coming out, and the nurse said she was worried that she might have had to deliver by herself. So yes, the backup doctor came and I pushed like maybe for 5 minutes and she was born. This time around though, I pushed differently than the first 3 births I had. The first 3 births I had, I was on my back. The nurse and my husband are holding my thighs up and I'm pushing on a contraction, like hard pushing, and then I'm breathing not on contractions. This time, nobody's holding my legs. I'm still on my back, but the doctor directed me to like push, like small pushes, and then breathing in between. So push, breathe, push, breathe, push, breathe, which I felt was like a smarter way to do it, because then I think I tore less this time. And it was like, yeah, it just seemed smarter and easier, and it worked well, though she was like coming out on her own anyways. But I did appreciate that way of pushing better. She was born at 4:50 a.m. So like, just a few hours after that text I sent that was like, nothing's happening here. I thought, yeah. Anyway, thing is, I planned, and all my listening for preparing for labor and delivery, I never mentally prepared for after delivery. So after you deliver the baby and they're placed on your chest, like I'm like relieved and like, okay, my job is done here. I'm good to go, But this time, they were having trouble getting my placenta out, and the cervix was closing, and they were struggling. So they finally did get my placenta out, but it didn't all come out, and there was a retained piece in there. So then I continued to bleed, and I was bleeding too much, and they were trying to get back into the uterus with just like their hands to try to get out that piece of placenta that didn't come, and it was too high for them to reach. So then they ended up saying like that they wanted to do a DNC. So they took me to the OR. So then my husband had to like keep the baby. And I didn't really get that like initial, bonding time with the baby right after birth, which was fine. It's fine. I'm glad that, they're checking to make sure the mother is okay and healthy before that happens. But I did miss out on that this time because I had to get taken to the OR and get a DNC. If you do not know what a DNC is, it's just like they were trying to get that piece of placenta out, but they couldn't with their hand. So they just using like instruments to go in there and be able to reach further and scrape out better. But it's still like going up manually through your vagina into your uterus. So they weren't cutting me open or anything, but it was a lot of pressure and I was not expecting that. And I felt a little bit psycho and barbaric, I guess, in the end. They did put me like a spinal block or something fentanyl through with my epidural. It didn't really feel any different than the original epidural. Like I didn't feel a difference in that, but it did, like I couldn't feel any pain. I could just feel the pressure, but the pressure was crazy enough like to have someone like, reaching up into your uterus with their hand and tools. It does feel crazy. And it wasn't fun, but also it wasn't traumatic in the end, Like I didn't feel like anybody was in a life-threatening situation. This is the most like barbaric I've felt in a birth, I guess. That would be the best word I can use to describe it. Like the pushing stage, and then the like them trying to clean out the placenta after. Like I just was like, whatever, screaming, not really screaming, but I did not feel like under control or very poised at all. But I hope that, they'll forgive me and that maybe they're used to that, hopefully, and they know it's part of their job. But yeah, in the end, yeah, that's how it went. It was okay, but I just wasn't prepared for a DNC after a birth, which maybe I feel like if mentally I had planned for that, I could have maybe composed myself better, but I don't know. What can you do? That's how it went down, and everything ended up, everybody was healthy in the end, so that's good. Now, having like 6 weeks passed and reflecting on it, I could have maybe in hindsight like asked them not to do the induction, and maybe I could have prevented the DNC if I would have like let my body go into labor on its own. But from like my previous experiences with birth, I could have been waiting another 3 weeks. She did end up being 9 pounds and 2 ounces at 39 weeks. So if she would have not been, born for another 3 weeks, who knows how big she could have gotten. They were trying to prevent shoulder dysplasia or her getting stuck during delivery. And I feel like a baby getting stuck during delivery would be way more intense and scary and traumatic than a DNC after, when the baby's fine and healthy and you're going to be okay. I never felt like my life was super in danger or anything. So in the end, I do feel like they did the best they could with the knowledge they had. And I don't know what the rates of fatality and stuff is with a DNC compared to a baby getting stuck, like large gestational age, or what the risks are. Obviously they do, and that's what their plan was. And so I feel at the end, I feel comfortable with how it went down, and that they did what they could with the knowledge they had to prevent anybody from risking their life. And yes, after all of that, like I'm always, after every birth, I'm always so appreciative and grateful for the nursing staff, especially. They always do an amazing job of taking care of me and making me feel looked after and respected and comfortable and all of that. And then this time around, I actually did get to experience a little bit more of the doctor's skill and job with the D&C, because the doctors had to do that. Normally with a regular delivery, or with my 3 previous deliveries, that I've seen the doctors, like, they come in, deliver the baby and stitch you up and they're gone. So you see them for like maybe half an hour and that's it. That is my story of my 4th birth, and I'm happy that this is my last and I never have to do that again. Thank goodness. So thanks for listening. I'll talk to you again. Bye.